Hi everyone, my name is Insha and I work at Pause for Perspective as a writer. Today we are going to be talking about one of the articles I wrote on trauma called The Politics of Trauma. In this article, we are going to talk about what is trauma, why do we think of trauma the way we do, and why is it that some people's experiences are considered as traumatic while others are not. Our social conditions have shaped the way we think about trauma. The two main forces behind the society's formulation of trauma are the political movements and the systems that disregard these violations. Today, we are going to explore these political movements behind the study of trauma as reviewed from David Treleaven's book called Trauma Sensitive Mindfulness. The concept of trauma was first added into DSM 3 as a rare and fatal stressor that is outside the range of usual human experience, prone to evoke significant symptoms which were marked as distressing to most people. Known as the silent epidemic, trauma deeply disturbs an individual's capacity to cope, triggering feelings of helplessness and reducing their sense of self. This psychological vulnerability is the outcome of the individual's usual coping mechanisms failing to acknowledge the psychological trauma. Due to this response, the individual suffers from severe desolation and along with physical deterioration. If one truly wants to understand the concept of trauma, then we need to understand the history behind it. When it comes to the history of trauma, there are three Western movements which play an important role in how we think of trauma today: the anti clerical movement in France, the anti war organization of veterans, and the women's movement. The anti clerical movement in France. The first ever scientific study of psychological trauma took place between the 18th and the 19th century. A French neurologist, Jean Martin Charcot, was the first person to study and define a disease known as hysteria. The term hysteria was derived from the Greek word hystera, meaning womb. It was a gender based diagnosis that was solely reserved for women. Before Charcot's research into hysteria, it was considered to be a disease with incoherent and muddled symptoms. Some of the symptoms include insomnia, muscle paralysis, fainting, and intense anxiety. While hysteria was considered to be the mark of the devil by the Catholic Church and was dismissed as witchcraft, the anti clerical movement had undertaken a rigorous study of traumatic stress. Charcot was able to record the growth and disposition of hysteria and exhibit that the disease was in fact psychological in nature. However, Charcot was unable to determine the source of hysteria as his approach was agnostic and did not provide a rational intervention for treatment. His focus was more on the neurological symptoms and not on the patient's inner lives. His students, Sigmund Freud and Pierre Janet, on the other hand, were fascinated with finding the source. It became their goal to research and possibly find a cure for hysteria. They started talking to the women suffering from hysteria and concluded that the symptoms were the result of psychological trauma. These symptoms, they believed, were the consequence of the altered state of consciousness resulted by their intolerable emotional reactions to the traumatic events. Janet labeled this reaction as dissociation. Freud and Janet found that the symptoms could be attenuated if the patient was able to enunciate or vocalize the traumatic incidents stored in the unconscious mind. Janet referred to this treatment as psychological analysis, a method of treatment that would allow an individual to verbalize the hysteria in a way that would be helpful in attenuating the symptoms. Psychoanalytic theory dominated the later part of the 19th century as Freud continued his research on the exploration of women's sexual life. He found a connection between sexually abused women and hysterical behavior. and for a brief time in history, women were heard. However, due to the immense pressure from his colleagues and no political backing for his thesis, Freud had to relinquish his research. His female patients were isolated once again, their voices silenced once more. This was until the anti war organization of veterans. That was the end of the study on hysteria until the wars brought this study back into focus. As soldiers were returning home with indescribable symptoms, terms like shell shock and combat exhaustion were introduced. This nervous disorder was presumed to be the outcome of the jarring effects of exploding shells. When the soldiers who did not face any combat also started showing symptoms for the same nervous condition, the medical professionals were under tremendous pressure to explain the phenomena. It was acknowledged that these symptoms were tied to the extreme states of psychological distress. The elongated subjugation to war produced the similar hysterical symptoms seen in the women examined by Charcot and Freud. This prognosis of combat neurosis was not seen as being honorable by the traditionalists. They questioned the moral integrity of these soldiers and deemed the soldiers suffering from combat neurosis as cowards, and questioned whether to give them formal treatment or not. The soldiers were threatened, punished, and shamed, and sometimes were also subjugated to electric shocks. This term of treatment continued. This form of treatment continued by the traditionalists until a group of new and progressive medical professionals formed a more humane approach, um, offered a more humane approach to treatment that could help soldiers return to combat without the hysterical symptoms. They were influenced by Freud's The Talking Cure, also famously known as psychoanalysis. Due to the success of the approach of this treatment, military establishments accepted that no matter how courageous a soldier is, it is possible for them to be traumatized by the effects of combat. This all changed, however, following the Vietnam War. This war is the next appearance in the study of combat neurosis, and unlike the two world wars, the Vietnam War faced mass opposition both inside and outside the military. Soldiers returning were suffering personally as they were feeling betrayed and deserted. Veterans who felt abandoned came together and organized an anti war movement. Rap groups were formed which offered them a safe space to discuss their experiences and raise awareness about the effects of war. Owing to this context, for systematic study of trauma, a new disorder was created, which later came to be known as PTSD, post-traumatic stress disorder. That was it until the women's movement. The next political movement that gave context to the study of sexual trauma decades after Freud's research was the feminist movement. This movement raised awareness about the everyday violence, both sexual and domestic, faced by women. The effects of sexual abuse and violence was more prevalent in women than the men who faced trauma at war. This movement not only challenged the notion that individual experiences may be understood outside social situations, but also the stigma faced by the women who spoke about their experiences. The predisposition to blame the victim impacted the direction of the psychological examination and led the researchers to seek an elucidation for the perpetrator's crime in the character of the victim. This form of repression made sure that women stayed isolated, but like the rap groups, feminists also organized consciousness raising groups to talk about their experiences. Through the unified efforts displayed by the women's movement and decades of study, sexual violence was finally added as a diagnostic criteria for PTSD in DSM 5. However, this movement was criticized for being centered around white and cisgendered women, leading to another wave of feminist movement creating an interpersonal and intersectional analysis, emphasizing the interlocking nature of systems of oppression. These above mentioned political movements and research work brings into focus that the social and economic systems which we live in depend on domination and violence, and how we are conditioned to see a situation as traumatic only when it is associated with a physical traumatic event. We are also deeply conditioned not to see the ways that racism, sexism, casteism, and homophobia can be traumatic. The oppression faced within the Indian context on Muslim communities, Dalit and Adivasi communities, queer communities, and women has created effects of traumatic stress which gives rise to intergeneration of trauma. When we witness a traumatic event, which is the result of an accident, We tend to empathize. However, if the same traumatic event happens to be the result of the social and economic oppression, it becomes complicated. In the context of trauma, we cannot diffuse responsibility. We have to pick a side. And if we choose to be neutral, then that means we have chosen the side of the perpetrator. At PAUSE, we are trauma informed and trauma sensitive practitioners who work with intersections of oppression, uh, people who who have experienced oppression and that lead to trauma responses. So this is all about the politics of trauma. Thank you so much for watching till the end, and I hope to see you next time. Thank you so much.